A warm welcome to everybody. Thank you very much for your interest and participating in this presentation, where I would like to show you the SPHN vision of a responsible health-related data sharing in the Swiss research community. Most importantly, I would like to explain the legal agreements which are needed when researchers wish to share health-related data in multi-center projects. Basically, when we want to share data in a responsible way, we need to consider the ethical and legal requirements. We need to raise the awareness to all stakeholders when we want to protect sensitive personal data in compliance with legal requirements. So planning and conducting research projects with health-related data imply certain requirements postulated by the ethical and legal regulations. Depending on the developed project plan, for most of health-related data collected from patients with hospitals, the patient's consent for further usage of that data is needed. For some further use projects, the general consent solution might be the appropriate one. Another requirement for most of the research projects in Switzerland is ethical approval. Typically, data are pseudonymized, respectively coded, following consolidated de-identification routes before using respectively sharing data with other institutions or hospitals in multi-center research projects. Some projects use anonymized data that do not fall within the scope of the Human Research Act. However, it is strongly recommended to still apply for an ethical statement describing the purpose of anonymization and its process in detail. Technical security measures need to be considered since security measures guarantee the protection of sensitive personal data in compliance with Swiss law. Another important requirement is to establish a legal agreement. This agreement defines the project specifications and responsibilities of participating partners in compliance with Swiss legal regulations and data protection requirements. The most known agreement, probably to all of you, is the Consortium Agreement. The Consortium Agreement regulates general principles of collaboration between research project partners, such as the rules for publication and authorship, intellectual property, financial conditions, and governance aspects. And since a few years, the research collaboration is legally completed by the Data Transfer and Use Agreement. The Data Transfer and Use Agreement describes under which conditions the data provider, such as the hospital, agrees to disclose patients' data to a recipient, such as a university. The Data Transfer and Use Agreement indicates technical security measures for processing health-related data, which, for example, prevent unauthorized persons to access the project data. So I have mentioned now already the Consortium Agreement and the Data Transfer and Use Agreement. However, there are different legal agreements that can be considered for multi-center projects. So beside the Consortium Agreement and the Data Transfer and Use Agreement, there is an additional agreement, the Data Transfer and Processing Agreement available. This agreement regulates the services of an external processor subcontracted by the parties. In the framework of SPHN, this would be the Biomed IT network. In addition, there is a material transfer agreement available which regulates the transfer of samples between the partners. Then there are also service agreements available to regulate the services provided from labs or software developers. These types of agreements can be set up as a standalone agreement or combined with each other, depending on the already existing contractual relation among the partners. The templates are available on the SPHN webpage or on the Swiss Biobanking platform. Note that the developed templates are also applicable for projects not funded by SPHN, but there might be the need to adapt some clauses accordingly. For projects not using the Biomed IT infrastructure, a data transfer and use agreement without external processes is provided. The published templates are documents that have been further developed by the SIB, the Swiss Institute of Bioinformatics. Initially, one of the templates, the Data Transfer and Use Agreement, was a result of an SPHN National Working Group, a collaborative group with representatives of universities, hospitals, SIB, and the Swiss Biobanking Platform in the realm of the SPHN initiative. The initial template had to be updated according to the needs of SPHN projects using a data processor, the Biomed IT nodes. With this revision, remaining aspects were covered, such as minimal security requirements or information and audits of security measures. In November 2020, templates for a consortium agreement, data transfer and use agreement, and DTPA, including all remaining updates, were then released and published on the SPHN webpage. Each of the agreements regulates specific aspects for using health-related data. They can be set up, as mentioned earlier, as a standalone agreement or combined. The Consortium Agreement regulates, as mentioned before, general principles of collaboration between the research partners, mainly negotiated between the principal investigators of each participating institution. It defines the principles of collaboration and data exchange, governance and financial aspects, confidentiality, as well as intellectual property rights, publication, and authorship. If health-related data is used from several hospitals in a multi-center project, Swiss hospitals must set up a DTUA which describes under which conditions the data provider, such as a hospital, discloses data to the recipient, such as a university. Originally, each data provider is controller of its own data. Once the data are collected and processed in such way that multiple institutions decide together why and how they process certain data, they become joint controllers of these data. This means they are responsible together for these data. However, parties can decide that certain parties of the consortium will not determine the purpose of the data processing. For example, a party will only provide technical and analysis help. All research partners of the institutional representatives involved in the transfer and use of data are part of the data transfer and use agreement and must sign. As integral part of the SPHN initiative, the Personalized Health Informatics Group of SIB established the Biomed IT network. This network builds a coordinated infrastructure for secure processing of biomedical data. The network consists of 3 nodes which are located in Basel, Lausanne, and Zurich. The nodes are connected to the data providers, such as the hospitals. Data coming from different data providers, such as hospitals, are transferred depending on the affiliation via the Biomed IT nodes to a secure project space on the main Biomed IT node, which has to be selected. The transfer is performed by an end-to-end encryption, and data on the secure project space can be accessed remotely via the Biomed IT portal. By using this infrastructure, the controllers of the project's data, so the data providers and recipients, subcontract the secure transfer and processing of data to a third party, which acts as a processor. To regulate the relationship between the data controller of the research project and the processor, a data transfer and processing agreement is set up. This processing agreement defines data access rules and minimum security requirements. The processor acts as a subcontractor according to the instructions of the controller. Let me explain now with a very simple example. There are two hospitals, A and B, which wish to share patients' data with a university. They wish to collaborate together in a research project. To show the different roles, you need to highlight who discloses data to who is the data provider, and who is accessing the data as a data recipient. In the example, both universities share data with the recipient and access also project data. Moreover, it is important to define who controls data. When the purpose and manner of processing project data are determined jointly by all partners, the data provider and data recipient act as a joint controller. Now, the next question from my side would be now, where is the project data stored and where do you perform your analysis? Let us assume the Biomed IT network with a secure project on one of the nodes is used. Biomed IT is then subcontracted by the parties as an external processor. And with regard to the legal agreement, you might want to set up a consortium agreement with an integrated DTUA and DTPA. Within this agreement, governance and financial aspects, intellectual property rights, and the regulation of publication are negotiated between the research partners. The partners may arrive at an agreement that the intellectual property is jointly owned by the parties. Then, to regulate the conditions under which data are disclosed to the other party, a data transfer and use agreement has to be set up between the research partners. In this case, as an integrated part of the consortium agreement. If the processing of data is provided as service by a third party, in this case by the Biomed IT network, a data transfer and processing agreement needs to be conducted between the respective partners. The processing agreement regulates services for a secure and safe hosting of data and data access rules. Which of the three Biomed IT nodes, Basel, Zurich, and Lausanne, have to be subcontracted in which role depends on the site of the data providers, the location of the university, and the services to be provided. One of the nodes, the main node here in red, it could be the Basel node, provides a secure project space and compute power for data analysis, whereas the other nodes might serve as transferring nodes only. In the SPHN context, data provider and data recipient often mandate the processor, the Biomed IT nodes, together. As mentioned at the beginning, it is essential to integrate technical and organizational measures that ensure the confidentiality, integrity, availability, and resilience of the systems with regard to processing of the project data. The provided measures are the responsibility of the recipient and ensure, for example, that unauthorized persons are not able to access data processing system. It ensures that unauthorized persons are not able to read and delete data in the system or during transport of data. It ensures examination and verification when and by whom data was entered into the system. It ensures an adequate organizational measure to protect data. For SPHN funded projects, the information security policy provides management direction and support for information security in accordance with SPHN requirements and the respective legal regulations. It provides control mechanisms ensuring confidentiality, integrity, and prevent misuse. You find this policy also on our webpage. Allow me now to show here a use case which might clarify the roads a bit more. It is a research project with 4 research partners using health-related data from 3 Swiss university hospitals: the University Hospital Basel, the University Hospital Bern, and the University Hospital Geneva. The ETH Zurich collaborates as the research partner. All partners are using the Biomed IT network, consisting of the Biomed IT nodes Basel, Zurich, and Lausanne. First, we need to define the roads. Each of the 3 hospitals provides health-related personal data using the Biomed IT network for a secure data transfer and analysis. In this use case, the main node, so the place for hosting and analyzing the project data, is the Zurich node. The Basel and Lausanne node act as transferring node only. All data is transferred to the main node and its defined project space at the end. The project partners have concluded a separate service level agreement with the Zurich node, which is the main node here. It regulates the required services they may need to conduct the project. Access to data on the defined project space located at the main node is given to all research partners. Thus, all parties are data recipients. In this use case, project partners determine together the means of data processing and act as joint data controller. With regard to the legal agreement, which is needed here, you would set up a consortium agreement between the University Hospital Basel, the Inselspital, the ETH Zurich, and the University Hospital Geneva. And to define the conditions under which data is disclosed to the parties, a data transfer and use agreement among the research partners is integrated to the consortium agreement. And since the controllers of the project's data wish to subcontract the secure transfer and processing of data to the Biomed IT network, you would set up a data transfer processing agreement. This processing agreement describes the data and services provided and is an annex to the data transfer and use agreement. It needs to be approved and acknowledged by the project partners. Finally, the legal agreements for sharing the data consisting of a consortium agreement and an integrated data transfer and use agreement with a processing agreement is set up. Once it's signed, data can be shared among the partners. Depending on the configuration of the research project, it might be sufficient to use a data transfer and use agreement with an integrated processing agreement only. For example, if there is already a signed consortium agreement or another equivalent agreement for the project. If the research partners decide to cover the legal framework with a data transfer and use agreement and processing agreement only, principal regulations of governance, confidentiality, intellectual property rights, and publication must be covered in this data transfer and use agreement. For projects not having any legal agreement among the partners, however, a full agreement framework consisting of a consortium agreement with an integrated data transfer and use agreement and processing agreement is recommended. But this depends on the project specifications. For multi-center projects which are not part of the SPHN initiative and not using the Biomed IT network, A data transfer and use agreement without processors might be used. In this case, the project partners have to ensure that the infrastructure on which the data is processed fulfills the requirements regarding information security. If there is only the need to cover terms and conditions for the use of a processing infrastructure, such as the Biomed IT network, a standalone DTPA might be the easiest solution. This is typically an option for projects with an already settled consortium agreement or data transfer and use agreement. It is strongly recommended to contact the Personalized Health Informatics group before setting up such an agreement. So we might be able to verify that the processing agreement covers all project needs. So we know now that it is important to define first the roles of project partners before setting up a legal agreement for sharing data. Once this definition is completed, you might be able to choose the agreement template that meets your project needs. Note that on the SPHN webpage, the legal agreements covering the integration of the Biomed IT nodes are provided with using a single node or with multiple nodes. To have these legal agreements finally approved and signed, it is essential to provide correct institution names and the duly authorized persons which are responsible for signing those data sharing agreements. For this internal approval, processes must be followed which require typically not only a review by the local project leader. You might need to reach out to the legal department or if applicable to your data access committee, respectively data governance board. And with this, I would like to close the presentation and thank you for your attention. And if our team can be of any help in order to set up an appropriate agreement, please do not hesitate to contact us via dcc@sib.swiss.